get started with the recording. So welcome everybody to the next set of our seminars in 2021 for the Canadian Health Workforce Network. So we're very, very pleased to have you all join us. And we are recording the webinar, and we will be posting to our YouTube channel and the Canadian Health Workforce Network website. I'd like to start off first. I'm located here in Ottawa, as many people who are participating. And I just do want to acknowledge territory. We are on the lands of the Algonquin people, who are the traditional guardians of this land. And we would like to acknowledge their longstanding relationship with this territory, which remains unceded. And we pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. And we would like you to take a moment to recognize and acknowledge where you're at. So I would like to pass along to my colleague, Brenda Gamble, who will be moderating the session and introducing our speaker.
Thank you, Ivy, and welcome everybody. I'm so glad you're all able to join us today. And it's with great pleasure that I introduce our guest speaker for today's webinar, Major-General Marc Bilodeau, Surgeon General for the Canadian Armed Forces. So today's webinar will showcase the Canadian Armed Forces and Department of National Defence and Wellness framework. It will particularly highlight the current Canadian Forces Health Services activities and vision in this area. So I'll turn it over to you, sir.
Yeah, thank you, Brenda. Thank you, Ivy. Welcome, everyone. Very happy to see that many people interested to hear me and to hear what I'm going to share, I guess, with you all this afternoon. You will realize that we're fairly early still in our journey regarding health and wellness of the defense team. But I think the earlier we share, the more likely we are to be able to influence and shape it for the future. And hopefully I can learn as much from you as you will learn from our experiments so far. So you're going to give me a few seconds. I'm just going to share my screen here, hoping it's going to work as it did a few minutes ago. Ivy, can you confirm that? Good. All right. So let's start by sorry about that. I'm just going to move this window here around. So just first, I'd like to say that il y a une version française, en fait, des diapositives qui vous a été distribuée ou qui va l'être dans le futur. Fait que si pour vous, les francophones d'entre vous qui veulent voir la version française, ça me fera plaisir. Puis dans les questions et réponses, ça me fera plaisir également de répondre aux questions en français. So I was just sharing the fact that there's a French version of the slide deck that is that has been shared, and I'll be happy to answer questions in both official language. I'll try to keep my remarks for about 30 minutes, hoping that this will leave plenty of time for questions and comments. I look forward to your comments because, as I said, we're still shaping what our health and wellness strategy is going to look like. And definitely in other organizations' perspective and other people perspective is useful moving forward. So this is what I would like to go through with you this afternoon. I first gonna tell you my story and where I'm coming from, because there's a reason why I got interested at one point in my career to health and wellness of our people. I'll describe a bit for those of you who don't know a lot about defense, what defense team means and who we're talking about when we speak about the defense team. I'll highlight for you the significant, I would say, strategic alignment that took place in the Department of National Defense over the last 3-4 years, which is basically setting the foundations for our health and wellness strategy. And then I'll focus more on our military health system and describing to you what it is and what are our priorities, I guess, regarding the health and wellness of our healthcare professionals working in that military health system. Share with you a bit of the influencers that have helped us shaping our journey moving so far, And then finally, I'll leave you with a few reflections about the future and where I think our focus needs to be. And obviously, I cannot ignore COVID part of that reflection, as you will, I'm sure, understand. So, you know, obviously, this is a long journey that we've just started, I would say 3-4 years ago. And we're still very early in that journey. It's going to take probably another decade before we are where we need to be. And we're never going to be where we need to be, I guess. We're going to need to keep improving on that because our people, and that's one of the key messages that I'd like to flash to you now, our people is our most valuable resource. We're in a healthcare business, and obviously who deliver healthcare, it's people. So ignoring that to start with is going to set us for failure. And I think that's very important to remind ourselves about that. The second one that I've learned mostly in the last decade is that leadership is an essential component of wellness. And whatever how good your programs are, if you don't have inspirational leaders who believe in wellness and who walk the walk and talk the talk, you're not going to be successful. That's where it starts. It starts at the top. It starts with the leaders, and it starts by the role modeling that those leaders are also representing to their people. And finally, and that's I'm going to the last point for the end, but that's going to speak about the challenge of defining and measuring success in that domain. It's a very complex domain that involves human being, and I would say sociology and culture. And the defining that success is challenging, but extremely important at the same time. And I'll share a bit of my thoughts with you on that later on. So my story. So I started in the military as a family physician 20 years ago. 20 years and a bit now. And what's unique to the military environment is we're exposed to leadership roles very early on in our career. And I would say in the first 2 years of my career as a military physician, I was given leadership responsibilities. I was in charge of teams. And when I say in charge, I mean from a military perspective, I was administering that team in addition to being their clinical team lead, if you will. And so that exposed me very early on to what it is to be a leader. And I've learned a lot very quickly, I guess, from being exposed to that role very early on, which I think makes me a better leader now because of the fact that I've been exposed to those roles for the last 20 years. Then soon after I started, I would say in the first 5 years, obviously I started having kids, and which changed my life. For those of you who have kids, you know what I mean, completely, to the point where I needed to reassess my priorities and I needed to make difficult choices. And one of those difficult choices for me was to stop doing emergency medicine that I've been doing for the first 10 years of my career. And this was a big step, a big decision to make, because emergency medicine was my passion. But there was no way I could keep up in being a full-time military physician, almost a full-time emergency room physician, as well as a father and an husband. So I made that choice. I made that choice because I knew I had to make it, because it's either that I was going to lose my health or lose my family or lose something, I guess. And so that move, which I still think it was the best move I've made in my life so far, kind of drove me to think more about wellness and the importance of trying to keep some type of a balance in your life. And it's not an equal balance, I think it's more an integration of the different aspect of your life in the right amount based on where you are in life, which changes obviously over time. When I didn't have kids, that balance was different than when suddenly I had 2 kids to take care of with my wife. And I'm sure when my kids leave home in 3 to 5 years from now, it's going to become again different, because I'll have different obligations, if you will. So that interest in wellness just kept growing then over time. And at the time where I was exposed to higher level and more complex leadership roles, which allowed me to be even more influential on the health and wellness of my people, to the point where I reached a point where one of my predecessors, who was the Surgeon General at the time, decided to nominate me as the wellness champion for the health services group organization, just so that I can keep having a dialogue, I guess, because that's the first step. I think it's recognizing that we have issues and having a dialogue with our people regarding wellness. And currently, as Brenda said, as the Surgeon General, I'm obviously the Defense Health Advisor. So I have, again, influence in more than just the health services group, but the whole Canadian Armed Forces and the Department of National Defense wellness team overall, wellness of the team overall. So that shows you, I guess, where I've been through and why I'm so interested now in that key component of health leadership. Just a few words to describe to you what the defense team means. So first, the Department of National Defense is a combination of a civilian component and the Canadian Armed Forces, which is the military component. So altogether, that constitutes the largest federal government. And it's the only government that brings military and civilian together. So as you can see there, we have roughly 68,000 regular force members. So those are our full-time military members like I am. We have roughly around 27,000 reserve force members, most of them being part-time members of the Canadian Armed Forces, and about 24,000 civilian employees. We like to speak about defense team, though, larger than just our public servants and military members. And we like to include our extended family with our family members that are, in our view, part of the defense team, but also many of our contractors that are working with us and helping us delivering on our business, if you will. And that's particularly important for us in the health services group because many of our physicians, pharmacists, nurses, social workers, psychologists are contractors. So they're really part of the team, even if their employment status is different than the public servant and the Canadian Armed Forces members. A bit on strategic alignment regarding what has been done, I guess, within defense over the last few years that are setting the stage, if you will, for a health and wellness strategy. So in 2017, the government launched Canada's defense strategy, which is called, the acronym for it is Strong, Secure, Engage, SSE. And what was unique with that new defense policy is the fact that the first chapter was about people. It was about supporting having a well-supported, diverse, resilient people and families part of the armed forces, which was a bit unique because all the previous defense strategy were focusing on hardware, I guess, tanks, ships, and airplanes. This one was on people, and because our chief of the defense staff at the time wanted that focus to be on people. He wanted people to be first. And that obviously drove many initiatives as a result, including one key one, which is the total health and wellness strategy, which is in a process of being rolled out slowly. And that would incorporate many of the key activities. Sorry, is there a sound check? Am I still good?
Yes, you're still good.
Okay, perfect.
I'll just remind everybody to mute.
Okay, perfect. Thank you, Ivy. Okay, so so the people first strategy basically was putting people on top of other priorities, which was very unique. Speaking a bit more about the total health and wellness strategy, which was a direct result of. God. Okay, I'm back online. Can you hear me, Ivy?
Yes, that's good. I'm just checking to make sure everybody's mute.
Okay, perfect. So that total health and wellness strategy that is, as I said, about to be launched in the next probably few months is intended to enhance mission success for the Canadian Armed Forces and the Department of National Defense. It focuses on wellness, strengthening the workforce, with the aim of ultimately becoming an employer of choice. Not that we're not one already, I think we are one, but I think we can always do better. It's based on 3 pillars that, not surprisingly, are the personal life, the work life, and the individual health. It puts a lot of emphasis on the ownership of wellness for each individuals, about their own wellness, but also the importance of leadership in enabling that wellness to happen, if you will. So being a facilitator of that journey that is a personal journey, but at the same time need to be collectively enabled. And obviously that strategy will come with an action plan that will put it to life, if you will. Just a bit of a summary of what that strategy looked like. And sorry for those of you who don't have a screen big enough, you may not be able to read the wording, but the dimensions are just describing basically the personal life, the work life, and the individual health, speaking about the total health from physical, mental, spiritual, and so on, and all the different social determinants of health that are around that middle node, if you will. Different interventions from assessment, obviously, we need to know what the problem is, to promotion and prevention, promotion of wellness and prevention of disease or issues, or health issues, and treatment and support, obviously. And it's targeting 3 different spheres of influence at the individual level, so the employee level, at the manager and leadership level, and finally at the organization level, with the different sub-bullets there that you will see. So that strategy, as I said, is about to be launched. I think it will draw quite a bit of attention by our members and by our civilian employees. And I believe with it's gonna help us, I guess, building a stronger future and a more resilient workforce ultimately. Now I'd like to move on to describe a bit what the Canadian Forces Health Services is about. And I like to describe our organization as the 14th healthcare system, after the 10 provinces and the 3 territories, because we're really a health system. You know, we go from training our healthcare providers to credentialing them. We're a regulator for some of them too, like our physician assistant, our medical technicians, because those professions, as you know, are not regulated in the civilian sector. And as you can see, we're dispersed all around the country in almost all provinces, except PEI, if I'm not wrong, and at least one of the 3 territories. We have a bit more than 6,300 employees overall, plus an additional 500 plus contractors. We have a training center, we have a medical equipment depot, we have different field units that are basically our pre-hospital type of healthcare support that are deploying when we go on mission in support of the Canadian Armed Forces. And we have 3 detachments that are outside of the country, 2 in Europe, 1 in Germany and 1 in Belgium, as well as 1 that is not illustrated on this slide, in Washington, D.C. So, and we provide care in most of those locations, mainly ambulatory care. We have no hospitals. We basically are managing an ambulatory care, and we're buying hospital and most specialty services from the civilian health sector. Most of what we do in a daily basis, I guess, in our bases around the country is treating healthy members, but also treating members who are experiencing mental health and physical health issues. I would say that 80% of our business is between those 2 domains, and another 20% is other normal things like infectious disease and so on. So that's who we are. And, you know, in alignment with the release of the strategic level document that the Defense and the Canadian Armed Forces release, we also release in the same timeline what we call the Surgeon General Integrative Health Strategy. So in 2017, we released that. And one of the key components, again, not surprisingly with that strategy, is the invest in our people strategic objective. So again, we've identified pretty much at the same time as the CAF identified, the Canadian Armed Forces identified the people as their people first strategy. We realized that it was important for us to invest in our people as well. And I'll describe a bit what we meant by that, because it's described a bit in more details in the strategy itself. So first, respecting dignity. Not surprisingly, I think that's where it starts when we take care of our people. One of the key components that is a bit unique to the military system is the barriers to care for our uniform healthcare professionals. So a physician in the military like me would receive care from its own organization, which, as you will understand, could create some significant obstacles to access care, because guess what? You would be treated by your colleagues that you work with on a regular basis. So we needed to acknowledge that, and I'll describe a bit further what we've done so far on this piece. We also identified the importance of building resilience and obviously providing support to our healthcare members who were suffering. We highlighted the importance of creating a culture that would be conducive to attraction, retention, managing talent was part of that too. And finally, we focus on professional development. All that part of our investing in our people strategic objective. At the same time as that strategy was released, the same summer, basically, the new Surgeon General at the time, Brigadier General, now Major General Downs, who retired last summer and was my predecessor, he appointed me as the wellness champion. And the reason he did that, it was more as a strategic move, I guess, to make sure that there was an understanding of the significant attrition that we were seeing in some of our trades, the high level of stress and burnout that we perceive was existing at the time. And obviously the fact that as healthcare providers, we're good at helping others and supporting others, but we're not usually good at taking care of ourselves. That's, I guess, how we're raised as healthcare providers, which doesn't help us being more resilient, obviously. And he felt that there was a significant risk from a human capital perspective if we were not doing specific actions trying to address that. So what we did, basically, we started by assessing where we were, trying to look at what was our initial state, if you will. Part of our accreditation process with Accreditation Canada, obviously, we're doing regular work-life pulse tool, which allowed us to understand a bit better what were the challenges, I guess, of our workforce. We also are conducting regularly public service employee survey in the federal department. And again, that was another indicator to help us understanding better what are the pressure points, if you will, in our human capital. We also have other tools like unit morale surveys, exit surveys that we do before people leave. And obviously a lot of human resource data from sick leave, disability, and grievances, just to name a few. So this allowed us to identify a bit more the problem and trying to focus our effort. And we did all of that with the hypothesis that investing in our people would first make us an employer of choice, enhance the military operation and our ability to deliver on those operations, but ultimately improve the quality and the safety of the care we deliver. And there's a growing amount of evidence that demonstrate that specific area of investing in our people, and you might have seen the quadruple aim, adding basically the health of the wellness of the healthcare providers as a fourth aim, and as a way to enable basically safe and high quality healthcare. So that's basically the hypothesis we've made to justify why investing in that area. So following that, we had a consultation, and we've invited, every year we have a meeting where we bring together all of our healthcare leaders team. And we've tried to identify priorities, because obviously there's a lot of things that can be done, but prioritizing is critical if we want to be able to achieve everything. So those priorities were developed, and you can see there. One of them was already ongoing. That's the Promoting Wellness for All. And I'll describe a bit more what our Road to Mental Readiness program looks like and how we've incorporated that for our health services personnel. The third one was the second one we decided to attack about supporting those who are unwell, looking specifically at the access to care issue. And finally, the second one, which is not forgotten, but this is one that requires a lot of work and a lot of big rocks to move, if you will, because we have an issue currently in the health services group in the military that there's a mismatch between the supply and demand. There's more need than we have people to fill those tasks, if you will. So we're now on a growth trajectory. Part of a modernization, basically, there's going to be a significant augmentation of the numbers of people we have to support the Canadian Armed Forces. So that will help, obviously, making the work manageable. Obviously, I'm talking about those two priorities now from a national level perspective, from a big program change, if you will. But obviously, we're trying to encourage all of our local units to do their own initiative, trying to improve those three areas. And there's a lot of good things happening. So lots of good pilot project and quality improvement initiatives are leading to very interesting results. And what we're trying to do is basically enabling the sharing of those best practices or those leading practices between the different subunits in our organization. One of the key elements, obviously, is leadership engagement. And, I really believe that this is an essential component of any health and wellness initiative. I believe we don't want to forget about it, and we don't want to make sure that all leaders at all levels understand that well. They understand their role, that the only way to succeed is to have their own people, their center of gravity. And that's the term we use a lot in the military, meaning that everything you do, you need to think about the impact it will have on your people, or how can your people help basically making it successful. And part of that, obviously, the mentorship component of it is critical in order to achieve that. First initiative I'd like to share with you is our Road to Mental Readiness program. Some of you might have heard about it in the past. It's been shared several years ago with the Mental Health Commission also, who've developed their mental health psychological first aid kit, I guess, based on the same principles. So we had the generic program for all the armed forces. And what we realized is there was a requirement to customize that program specifically for health services providers, considering their unique need from a health and wellness perspective. So we did that with key objectives in mind, obviously, of trying to prevent mental health issues, trying to promote and maintain good mental health, and in the end, trying to provide additional skills so that our people could better manage under the stressful circumstances of their role. And as you can see, this was delivered. This is delivered under three different phases. One of them through an online module initially, then a full day in class that was pre-COVID. So we've pivoted a bit on that perspective since, and an individual post-training self-assessment, if you will. And part of that is a key element, which is the mental health continuum that you see at the bottom. It's just a short version of it. It's basically helping people understanding where they are every day on that spectrum between being healthy and being ill, and what they need to do as defense mechanism in order to protect themselves from moving from the left to the right, if you will. So that self-assessment and that self-awareness, I guess, of how we feel is a key element of our Road to Mental Readiness program. And you will talk to military members and you will ask them which color they are, they're going to know exactly what you mean. And because we've taught that to all of our Canadian Forces members, and we felt that it wasn't different for healthcare providers compared to the rest of the group. So this is why we kept using it and we're still using it now. If you're interested to know more about the Rotameter Readiness program, we have an app that is available both on Google and Apple. And that app describes basically the different aspects of the program, including the 5 different skills that you see there, as ways basically to help people reacting under stressful situation. And interestingly enough, this has been extremely well received by overall all Canadian Armed Forces members, as well as all healthcare providers, because these are simple tools, simple ways of better manage your own internal stress and anxiety. And this has made people more efficient and more confident about themselves too. The second aspect and priorities that we'll look at is the barriers to care issue. You see a few quotes there from the Health and Lifestyle Information Survey, as well as the Canada's Defense Policy. So we know there are significant obstacles to access care. And our hypothesis initially was that it was mainly for mental health, but you will see later that it's not really the case, and physical health seems to be an obstacle as well, at least for our healthcare providers. So what we know about barriers to care, I mean, you will all recognize, I suppose, those different elements, and this is coming from the Academy of Medicine of Ottawa. So lack of time, obviously, we're all very busy. Difficulty in access, which is, again, another important aspect. Concern with confidentiality, you know, when we receive care from our people, if you will, and this is specifically an issue for us in the military for our uniformed personnel. Negative impact on careers, so we can't ignore that mainly in the military, because when you're sick, you may be released from the military because of that. So that's a key factor. Stigma, obviously, unsupportive environment, and denial. We're very good as healthcare providers to be in denial regarding our own health, and I'm guilty as much as many of you, I'm sure. So what we did, we asked an organization that works in the military that is called the Military Personnel Readiness Analysis Team to do a study for us. That was basically a survey that we did for all of our healthcare providers, trying to identify what those barriers were, and trying to determine if it was more for mental health or physical health issues. And I've highlighted there, I circled there 3 key elements that will drive how we want to address that specific issue of access to care for our healthcare providers. First one being about concern about health information, because obviously we have one military health record that stores all the information. And guess what? If you're healthcare providers, you're going to have access to that system. We're trying to control and monitor logs of access and everything, but there's still a worry that people who are accessing care in their own lines, I guess, will have their information looked at by others. So this is a legitimate concern. I think we have mechanisms in place to protect it, but it's still a concern that exists. Conflict with career goals. I described earlier that declaring you're sick may end up having you potentially not employable in the Canadian Armed Forces. So this is a significant showstopper for people to access care. And finally, the last one being discomfort about accessing care in their workplace. And this is exactly the system we have in place now. So as you can see, those are significant obstacles. And our goal now is to look at how we can smoothen those obstacles and make it easier. So we're looking at different ways, different alternative ways of people for accessing care outside of the military. Losing a bit of visibility on their healthcare, but in the end, ultimately, we think we're going to win because more people will be in care and accessing care when they need it. And there's going to be additional step to that survey where we're going to keep monitoring these specific parameters throughout the different initiatives that we're going to do. Just a few notes on a few external influences that were relevant to me personally, but also to our organization in moving forward. Just an example of a framework that the Alberta Health Services developed, and I was basically made more familiar with that program because I was there for a few years in Edmonton. So as you can see, not very different than our total health and wellness strategy. It speaks about resilience at the organization, leadership, and individual level. It speaks about the total health piece with the physical, emotional, mental, and spiritual. So, you know, most of those strategies are very much aligned with each other because they just make sense. Another good tool that I don't know if you're familiar with, but this was developed a few years ago, where the Mental Health Commission of Canada and the Canadian College of Health Leaders, as well as Healthcare came together and tried to map the 13 psychological factors for health and wellness in the workplace with the LEADS framework, trying to see how the LEADS framework could help basically putting in place those different elements in a workplace. Very good document that provide a very good toolbox, if you will, to see how each of those elements that you see in the blue circles there could be addressed as a roadmap, if you will, to improve health and wellness in our healthcare team. So if you haven't seen that document, I highly recommend you as a reading, because I think it's a very good start for any organization who doesn't know where to start, because that helps you mapping where your pain points are before you launch on any initiative. And finally, a bit about the future. I'll share with you a bit of my thoughts. COVID is obviously a significant added stressor now in on all of our healthcare teams. It's putting a big stressor on our healthcare systems, as you know. And obviously we can't ignore the long recovery that will follow. And when I say long, I think it's going to be years that we're going to need to recover from that. So how do we learn from it, capitalize on it, and make sure that we're building a stronger team moving forward? That I think there's more sensitivities now regarding health and wellness than there were a decade ago, and I would hope that the COVID pandemic has raised the awareness a bit more for some of our people. So I think there's an opportunity there, you know, like with every crisis. Virtual care is now more present than ever, and I suspect some of it will stay. And this may become another way, certainly for us, I guess, to provide better access to care for our healthcare providers. So I think I would like to challenge all of us, I guess, to look at those opportunities and see how we can capitalize on it moving forward. We know that we don't have a lot of time to capitalize on those post-crisis, because it's easy that the routine just comes back and we forget about what we've learned. So I think we need to start thinking about it now and having a discussion about it now, as much as we need to start thinking about recovery now, even if we're still, some would argue, in the middle of the crisis. And finally, and it's my last point before my conclusion slide, it's the challenge of defining success. And I have no lesson to teach you there, because we haven't done a good job ourselves in defining and monitoring success. But considering that we're all working very hard, we don't have a lot of white spaces in most of our schedule, we can't afford just to do things for the sake of doing things. I think we need to make sure whatever we do, that it's meeting a need, that it's meeting the objective we want to pursue, but also that we're measuring our success. Tokenism that has no room in our healthcare systems because of how stretched we are. So I guess that's a challenge I'm raising to all of us, basically, is to make sure we make the effort of defining what success means, and we make the effort of measuring what we do. This way we're not spinning our wheels for no good intent other than having a feeling that we've done something. And I'll stop on this slide, just I guess a reminder of my 3 message for you, and it's a good message for me too, as a reminder. So our people are our most valuable resource. Leadership is essential. It's an essential component to wellness. And finally, the challenge of defining and measuring success. I'll stop there. I'll stop sharing my screen as well, and I'll give the floor back to Brenda, I guess, to manage to facilitate the Q&A.
Okay, thank you very much for this great presentation, and what a wonderful message to remind us of investing in people. I think we forget that, We are also focused on being efficient with our time and producing more. And it's important to step back and think about our life and the balance in life. So thank you very much for this excellent presentation. So we do have questions, and I'd like to invite people. Evelyn, you sent one in early. Would you like to be first here, please?
Great. Thanks, Mark, for a fantastic presentation. Very informative. I really enjoyed it. I have one comment and one question. The first comment, or offer actually, is the health and wellness of Canada, armed forces, staffers writ large. Dr. Rachel Thibault, who happens to be an occupational therapist, has developed a series of 5 webinars called the Resilience Webinar in the context of COVID. I'll be happy to send it to you because staffers from other federal departments, including Veterans Affairs, have really benefited from it. So that's one part for the staffing side of armed forces. The second one is a question as part of the health and wellness strategy, which was launched in 2017 after the last election. I think I met you at similar conferences, and there you said that we would be increasing the complement of occupational therapists, particularly to support armed forces personnel wanting to return to work. And I just wanted to know if there's any progress on that front. That's my question. Thank you.
Yeah, thanks, Evelyn, and good to see you again. Happy to see your face, and you know how much I love OT. So you know I'm a fan.
Oh, well, thank you.
Yeah, and yeah, nothing is quick in the government, as you know. So this is always a slow process. What I can tell you is part of the total health and wellness strategy that that is about to be launched. There is a component of additional people, and we're looking at occupational therapists and case managers, because those are, you know, helping us transitioning our members out of the military at the end of their career. And we hope this will be approved, but I told you that 5 years ago too, so we'll see.
Okay,
thank you.
Great. Jelena, am I saying it right? Pronouncing your name right?
Jelena, yeah. Hi everyone, and hi Mark. Thank you for such excellent presentation. I just had one question related to COVID-19. So basically, research has shown that COVID-19 has resulted in worsening MH issues for those with pre-existing mental health conditions, and also onset of mental health problems for well population. So will, and if so, how total wellness strategy that you discussed incorporate and try to address COVID-19 related challenges?
Yeah, so that's the beauty of the strategy that is about to be launched. It's going to be adaptable, I guess, to the circumstance that our defense team is affected with. So obviously we can't ignore COVID, and the numbers you're describing regarding, not numbers, but the trends you're describing regarding people who were sick before COVID are just getting sicker with COVID. And I would argue that it's more than that. I think it's people who were suffering in silence before COVID are still suffering even more, but potentially still in silence for many of them. So we know it's just increasing the mental health burden for the society. And it's certainly not different in the defense, Ministry of National Defense and the Canadian Armed Forces. We need to get prepared for it, obviously. And that health and wellness dialogue needs to start now. My role as the medical advisor to the Chief of the Defense Staff is obviously to start having a dialogue about it, start making sure that leaders know what to expect and how they can support the best they can their people, understanding that it's very challenging for some of them because many of our people are working remotely. So how do you support from a mental health perspective, people that are remote and that you don't have face-to-face on a regular basis with them. So that's a real challenge that I think we need to address. We need to make sure we're giving the tools. We're looking at different toolbox, I guess, that could help supervisors in doing that, daily or weekly checkout with their people. But that's essential. That's essential because that's how we're going to be able to bring them to the service they need as quickly as possible, because we all know that the longer we wait, the harder it is to bring them back to a functional level. So yeah, real challenge. I think we're tracking, but I would say that if you were hearing me every week, I'm talking about it to the senior leaders, because I think we need to reinforce that message quite a bit. Because this is a big vulnerability for us post-COVID, in my view.
Okay, thank you, Mark, for your answer. It's great that you are working on that because it's so much important.
Pleasure, thank you.
Our next question comes from Peter.
Thank you very much for your presentation. A variety of studies in civilian healthcare workers have shown that moral distress, which is one of the precursors to burnout, and burnout itself, due to other causes, is usually due to systemic issues, not due to a lack of individual resilience. And I'm just wondering whether you have any similar measures in the military, and if so, do you have any examples of how you are working on the systemic issues, perhaps some of those local sites you mentioned? Thank you.
Yeah, very good question. And as you've seen in the total health and wellness strategy, there's an individual component, a leadership component, and an organization component to it. I think that's what you're referring to, so the systemic issues that are part of how the organization is built or operates that basically impacts negatively morale, mental health, wellness, and so on. So I don't have a specific example to give you. I know we've had a good dialogue recently about racism, and we've highlighted some of those systemic racism issues. And I would say that some of them are not that far from what assessment we can do from a wellness perspective. Sometimes it's policy driven. Sometimes it's the way our policy are written that are not necessarily meeting the intent in the end and are making people penalized or suffering because they don't meet the specific criteria of the policy. But if you look at the intent of the policy, they should have been supported, for example, for whatever compensation for their move, for example, because we move a lot in the military, as you know. So I think it's having that lens, I guess, when you look at issues. A bit similar to an approach we developed a few years ago about having a gender-based analysis plus lens on everything we do. We almost need to add a wellness lens in everything we do, a health and wellness lens, to make sure that every policy decision keeps in mind the impact it can have on people. And this way we're better positioned to make the right decision, or at least to mitigate the impact that this has on people if you have to make that call anyway. So I think but in my view, this is culture. This starts with culture, and I think that brings the culture dialogue and the fact that we need to have that discussion. We need to work together. We need to speak about it, and this way we're going to be more aware of the challenges, I guess, that our decisions are impacting. And this is how we're going to be able to address potentially those systemic issues that are the root cause, I guess, of many of those health and wellness challenges. Does that answer your question? Sorry, I felt like I turned around the pot of flour, but I think we need to have the dialogue and change the culture, and it's step by step. That's the way it is, and taking concrete actions that will make a difference in the end.
Thank you.
I think we have a question from Kyle, and Ivy, do you have that question for us?
Yeah, so from Kyle Bell-Humer and Dr. Bilodeau, it was mentioned a couple of times the barriers to access. One common point of sharing from the Canadian Armed Forces members is also the limitations of which professionals that they can receive services from. Will the future hold a space to open more opportunities for members to see other professionals and also engage in other approaches that are currently not authorized at this time?
So I'm not sure exactly, Kyle, what you're referring to, because we basically are trying to mirror our healthcare system and our spectrum of care to the provincial healthcare systems. So we're trying to be as good as the provincial systems. Sometimes we're looking at the best provinces and we're trying to mirror that. And obviously we don't have all of those services internally. So that's why we purchase and buy a lot of services outside of the military through the civilian healthcare sector, and we're paying for that for our members. There are a few things that we don't have though. For example, we don't cover massage therapy, just as an example, which is part, as we know, of suite of health benefits for many employers. So we don't have that currently in our system. But I think overall we're providing a lot of, and I don't know, Kyle, if you want to add further regarding a specific area that you were referring to, but I think we give access to our members to most of what Canadians will have access to overall.
Great, thank you. The next question is from Beden.
Good afternoon, Dr. Bilodeau. Thank you very much for your presentation. It's very eye-opening from somebody who is both a clinician and a researcher in this area of health, human resources, workplace mental health issues. I'm wondering if you can, and I think you probably have spoken to this in some of the examples you provided, but I'm wondering if you can speak a little bit about the potential partnerships or partnerships with academic institutions with the Canadian Forces Health Services Group. I'm very interested in learning more about this because as an academic, we traditionally like to reach out to different partners, and with the military, I understand that there's a lot more issues around confidentiality and things of that nature. So I wonder if you can speak a little bit about that so that we know how to best prepare, for example, to reach out to partners and to put grants to address some of these very important issues.
Yeah, excellent question. Thank you, Beden, for that. So far, with most of our research activities related to the health and wellness of our people has been internal to defense through Defense Research and Development Canada. So that's DRDC, that's our research institution, if you will, for the defense, as well as many subcomponents of that. So that's been focused there. Obviously, you're probably aware that we have a key partnership with CIMVR, the Canadian Institute of Military and Veterans Health Research, and the consortium of, I think it's close to 40 different universities in the country now that are participating to CIMVR. And when we have a specific ask for a research question, and I see David Padler there showing up, I guess. A specific ask for a specific research question, then we can reach out to our partner, to CIMVR, and we can basically, through an easy mechanism, contract, if you will, CIMVR to answer that question for us. We haven't done yet this specifically for the wellness of the healthcare providers. Definitely, I think there's going to be room for academic engagement and hopefully bring a bit of science into what we do. Definitely.
Great. Ivy, you have a question.
Yeah, I'm always very interested in these issues. We have a project, and Yellen is one of our partners, looking at healthy professional workers in the civilian sector. And I'm just wondering what is transferable. Like we're doing some research on physicians and nurses. Some of those are in hospitals, some of them are in community. Dentists are definitely in the community, midwives, go back and forth. So I'm curious about, what would you say is transferable about this to the civilian sector? What can we learn?
Yeah, I think a lot of it is because a lot of it is basic leadership and basic, good people management, I think. So I would think that many of the challenges are shared by the different organizations, whether if it's military or civilian. There's some things that are unique, obviously, for us, and the fact that we need to access care from our whole system is, I think, what makes it very unique for us. So that's why we're trying to focus most of our efforts in what's unique to us, hoping that we can learn from others regarding the generic things. Because the obstacle to care, for example, I share with you from the Academy of Medicine of Ottawa, are not unique to any environment. I feel, you know, they're basically very standard for most healthcare providers, and that's who we are. You know, we just don't like to look at ourselves and consider ourselves sick and admit that we need help, and that's unfortunate, but that's how we were raised, I guess. I think it's changing now. I think the new generation are more aware when they're being trained about the importance of taking care of themselves. So I hope we'll see a shift over the next few years. But for older people, I'm not old, but I'm older, I guess. Like me, it's still a challenge, I think, for us. Yeah.
Thank you. That's wonderful.
Okay, we're pretty well close to the end of time. So thank you, Major General Bilodeau, for your presentation. Thank you for your service as a healthcare provider and part of the armed forces. We certainly appreciate you taking this time to share with us your thoughts and information about the 14th healthcare system in our country, and reminding us how diverse we are, but how similar we are in our needs and approach to healthcare. So Ivy, I'll pass it over to you now.
Thank you so much, Brenda, and thank you for giving us the opportunity to have Major General Bilodeau present on this initiative. Brenda is our lead for healthy workforces with the Canadian Health Workforce Network. We will be tidying up the video and posting that up onto our Canadian Health Workforce Network website. We will make sure that the French slides are accompanying those. And please stay tuned. Our next webinar will be February 25th. We're doing that in partnership with the Canadian Interprofessional Health Collaborative. And Aaron Freyer from the United States and myself will be discussing looking at health workforce planning from an integrated interprofessional focus. So if you are not yet a member of the Canadian Health Workforce Network, please do. It's free. Follow us on Twitter. We have a new YouTube channel, which we will be posting all of our webinars up there. We are a very small organization that we do a lot of this work off the side of our desk. And so just be patient with us, but we're really hoping to take this moment to be able to say something quite specific about better supporting our health workers across Canada. So thank you again, Major General Bilodeau, and thank you everybody, and hope you have a lovely afternoon.